So we're going to follow up on our patient. Right now, patient stated with us that she tried chewing gum with the smoking cessation, and she started exercising. She's cutting back on the cigarettes, and she has completely stopped the marijuana usage. Patient started trying with the patches, but the patches didn't work out very well. Um, the gum did help her with the in reducing the number of cigarettes that she was smoking daily, which was from 2 packs down to 1 pack. So that was a plus. Patient also stated that the pack, she's trying to reduce the pack a day. So she's usually mainly using them when she's doing her restroom breaks. It helps her to relax and relieve tension. Um, Also, we also reminded the patient that quitting is going to be a journey for her. We know it's not going to happen overnight. The small progress that she's making is great, and with the exercising, that's helping her as well with spending time with her grandkids. Um, all of this was all related to stressors, which she has stated that she's reducing now because she's drinking Pepsis and with little exercising and eating sunflower seeds. So we also want to refer her to a nutritionist so that we can reduce the sugar and the salt intake because we don't want her to jump from one bad habit to another. So patient is willing to do all of that and as well. Um, she's dating now, which is a plus. And we stay in contact with her as the community health worker. We're encouraging her and we're providing her with more resources to deal with her stresses. And we informed her to increase some more of her exercises. And she states that with the holidays being around, the grandkids give her a lot of relief. So, and the housing situation has been addressed, so she's in stable housing. So she's doing awesome now.
Sounds like some great progress. So how much is she smoking now?
A pack a day. So she quit from 2 packs to 1 pack.
Great. And what's the time?
But that's a reduction.
Yeah, definitely. What's the timeline been again from the reduction from 2 packs down to 1 pack?
Case was presented mid-May, if that's helpful.
Yes. It was like earlier this year, so it's been over 3 months.
Gotcha. And then can you tell us more about what she didn't like about the patches or how she was using them?
This is Latanya. I can speak on that a little bit. She just said that the patches, they were sticking to her. Can you hear me?
Yes.
Yeah.
Oh, okay. I'm sorry. She just said the patches, the adhesive was just sticking to her skin, and she didn't feel anything any different with them on or off. She found out that she was still smoking the same amount of cigarettes with the patches versus the gum. Yeah.
Gotcha. Okay. And then the gum, is she using nicotine gum or just regular gum?
She stated that she's using both. The nicotine gum, she just said it was for, when she told me, I should have asked her what kind of stuff, but she said it was nicotine gum, and then she said it's over-the-counter chewing gum as well.
Okay.
So we have been supplying her with chewing gum over the counter, and I believe she is one of our referrals that the Quit Line spoke with, and giving her gum and stuff. I'm not 100% sure. I have to double check that though.
Okay, that's great. Those are my clarifying questions. Does anybody else have any clarifying questions for Latanya or Candace before we do some more discussion?
This
Steve?
is Steve. Does she have coverage in case she needed a prescription drug to help her stop smoking, like a varenicline? Is she covered with a Medicaid or other insurance?
Yes, she does. She has private insurance.
Thank you. To go from there, just to go from there, she might be a candidate for a oral varenicline treatment, because 1 pack a day is still a fair bit of cigarettes, and going from 2 pack a day to 1 pack a day helps getting you closer to quit, but there's very little health benefit from cutting back, because 20 cigarettes a day is still a whole lot of cigarettes. So it might be worth considering that as medication. It's easier to use, and it's probably the most successful medication to help people stop smoking.
I'm sorry, what did you say that was again?
Varenicline, or Chantix, is the brand name. Varenicline.
Okay, got you. Thanks. I will, when I speak with her again, I will talk to her about those things. And it may be her cigarette intake may be less than a pack a day, because she has stated also that she spends a lot of time with her grandchildren too, and that she know what the secondhand smoke causes. So she said so the intake, I'm thinking the intake may be a little less than a pack a day, but she does fairly smoke quite a bit still, but she has cut down a lot.
Yeah, great. That sounds like it. Remember we had the presentation about third-hand smoke, so you can talk to her about third-hand smoke with her grandkids too, if her grandkids are part of her motivation for quitting. So when she's smoking in her home or in her car, that there's still the chemicals and the volatile compounds that'll be reactivated that her kids and grandkids are exposed to if she's smoking in those environments. So that might be another thing to just use as continuing to motivate and help her take the next steps to quit completely. And the varenicline, if she has not tried any medicine, I agree with Steve. This is a patient that I would definitely want to talk to about medicine to help her quit completely, to get the full health benefits, for sure. Any other questions from anybody? And how about any other thoughts, recommendations? I suspect Frank and Amy might have some more tips and ideas for you on other ways to help her get all the way over the finish line of quitting for good. Frank, do you want to go ahead?
Yeah, so first of all, I'm kind of confused that the patch did absolutely nothing. I kind of question. So I would really ask her how she used it. Did she just put one on one day and then a couple hours later didn't feel much different and took it off? Did she actually use them the way they were supposed to be used? What was the dosage that she was using?
I don't have that information right here with me as far as the dosage that she was using, but I do know that it was over a 30-day period. And, we didn't want to make the patient feel uncomfortable with saying that, normally this patch should give you some type of sensation or something, make you feel some type of way. But so, just basing it off that everybody's different.
Okay, so then if you were comfortable that she was using it correctly, then she probably wasn't getting enough nicotine just from the patch. So just as general knowledge, you can combine the patch and the gum together. You can use the gum while you have the patch on if you need more relief.
Okay, we'll most definitely share that information with her.
Yeah, it sounds like she's just using the gum to deal with specific urges or, here and there. It's really meant to be used on a consistent basis throughout the day to prevent urges. So if she likes the gum and she's using it correctly, then I would really tell her at some point to pick a quit day where she is off the cigarettes completely, and then start using the gum like one piece every hour on the hour throughout the day. And then that should give her enough relief from any withdrawal. I also would really, to your point you just mentioned about how much she's smoking, you say in here that she's only smoking during bathroom breaks. Well, there's 20 cigarettes in a pack. So I would clarify exactly how much she's smoking, because I doubt that she's taking 20 bathroom breaks a day. I mean, not to be funny, but you know, those two things don't go well together.
Well, she probably not taking 20 bathroom breaks, but she may be smoking 2 or 3 cigarettes at each bathroom break.
At each bathroom. Well, that's possible, but again, if she's doing that, what's happening is she's actually making the situation worse because she's loading up, getting this really high amount of nicotine that is then dropping, to a much lower amount. So she's actually making her withdrawal worse if she's smoking 2 or 3 at a time during a break. Does that make sense?
Yeah, it makes sense.
Yeah, so I would really question her about that. The other thing I would really caution all of you is do not have people use chewing gum and nicotine gum simultaneously, or not even simultaneously, just on the same day. Because what happens is they tend to then use the nicotine gum as if it were chewing gum. And if they do that, they're not getting the full amount of the nicotine that they should be. The whole point of the nicotine gum is just to chew it a few times until you get that tingly, peppery taste, which is the nicotine, and then park it between the cheek and the gum. Unfortunately, most people don't do that. They chew it like regular chewing gum. So if you're doing a piece of nicotine gum and then 2 pieces of gum and then a piece of nicotine gum, the tendency is that you're going to chew the nicotine gum incorrectly. So I really discourage her from doing that. But I definitely praise her for everything that she has done. She's made some great steps. I would just now get her to the point where she has a quit day and she's done and can move on.
Great, that's helpful, Frank. Yeah. Thanks.
Great.
Go ahead, Candace, I'm sorry. Go ahead.
No, I was just saying awesome. Thank you.
Yeah. So just the next steps, that's great. Anybody else have any ideas or inputs for Candace and LaTanya?
I think given the confusion over the nicotine gum and the patch, the simple twice-a-day pill might be the easiest road to try with her, with the varenicline as an option to tinkering. Once people have tried something in the patch, they don't like it, they're confused about the 2 different chewing gums. That seems to me, in this case, the simplest road to take if she's willing to.
Hi, this is Amy Scora. I was also going to say that too. That sounds like varenicline or Chantix might be a really good option for her. So just having that conversation, seeing if she might be willing to do that. It's a pretty low maintenance, again, 2 pills a day, and very effective. So that might be a good option, but just having those conversations around medications, because it doesn't sound like she's getting enough of that nicotine just from the gum and how she's using both of the different gums. So having that conversation about medications. And I was also wondering, has she been referred to the state quit line, and has she worked with the quit lines at all in the past too, or currently?
I believe she is one of the referrals we turned in. I'm going to have to double check that to make sure.
Okay. Yeah, just another good resource for her to have in her back pocket, especially it sounds like, there's still certain times where she is smoking and she can get some good strategies and advice from them on what she could do to replace that smoking, and really having that plan in place to continue to reduce and get those full health benefits by reducing their smoking and getting off that whole pack of cigarettes. So
most definitely. Thank you.
And this is Linda. I just wanted to add in there that if she goes with Chantix, she will need a prescription for that. So she'll need to see a doctor or some kind of a provider to get a prescription. And also you can still be smoking when you start Chantix. And so that may be another thing that is attractive to her, is that she wouldn't have to set a quit date for when she starts the drug, but could taper off and set it out a little bit. You raised a couple of really important issues about when she smokes and why. I think it really would be worth having a conversation with her about that. Is it just bathroom breaks, or is she smoking, running out early mornings and smoking, just when she smokes and why, and what it would take for her not to pick up that cigarette at that time. The man she's dating and her grandchildren seem to be real motivators for her. So, maybe stressing, even if you've cut down one pack, and that's great, you're still not quit. So don't give up yet. You still have some work to do here. And that certainly, her clothing, and she still smells probably like cigarettes. That may be something
Yes.
that she wants to get rid of and not smell that way, for the person she's dating as well as for her grandchildren.
Absolutely.
But she's doing great. And I would agree with, I think everybody said, she really needs some praise for having come this far. But we also don't want her to
Absolutely.
stop here and not, get to being smoke-free. So great work with her.
Thank you.
Yes, thank you, because that is her goal. She wants to stop smoking. So thank you for all your input and information. We most definitely will share this with our patient.